Yes, yes.
Wonderful. Talene is here. Yeah, it's so nice to see faces. We see screens and have to endure screens so much. It's really nice to see faces. Also, we'll be going into breakout rooms and chatting amongst each other. So, yes, it's not compulsory, but it's always nice to see faces and smiles. Especially, I'm sitting in Cape Town here, and there's orange warnings of like torrential downpour, roofs are flying off. It's chaos here. So it's really nice to see nice smiling faces. Wonderful. Okay, we're going to kick off. Just a quick reminder, choose your interpretation channels, the ones that you need. Also, very, very important, if you are not comfortable working in English, because we're going to be doing lots of deep dive breakout room work today, please change your name to the language you need interpretation for and your name. This will make it really much easier when we're assigning breakout rooms to make sure that you stay in plenary and you're able to receive the benefits of the simultaneous translators that we have today. So thank you so much, translators. You guys are doing God's work here today. Thank you so much. Okay, so I think let's kick off. There will be people coming in dribs and drabs, and they can join in. Welcome to the second session. Last week was the first one. For those who are joining us again, welcome. We've done a lot in the last week. So just a quick reminder for those of you joining us for the first time, or who lots of life has happened in the last week, why we're here. So we're here for a number of reasons. One of them, especially when it comes to the catalytic investments here at Global Fund, we're really thinking about how do we refine and prioritize key design directions across these catalytic investments. So we had a wonderful presentation from Anna last week. I hope you were able to read in the summary that covered some of these design directions that the team are exploring. We really want to identify priority support areas, especially in the current context of severely reduced funding. And we really want to come up with kind of community generated ideas around strengthening cross movement work because the communities are the ones that are doing the work, so have the best ideas of how to strengthen the work. And then finally, really what we're going to be doing at the end of today is identify practical ways to sustain community involvement beyond this consultation. So the idea that this consultation is just very much a small part, like the first beginning steps of figuring out how to embed long-term community consultation through this process so that it's not just this, that it is something that continues throughout the implementation stage. So this is kind of the four major things we're trying to achieve in the session last week as well as the session today. So, for those who were here last week or were able to read in the summary, last week we really started talking about these kind of five different areas, this kind of design decisions and design areas that we're exploring, and put into five different thematic areas. So, around investing in capacity of community-led services for integration, piloting alternative community financing models, embedding community-led monitoring in purchasing health services, strengthening community engagement in national decision making, and fostering collective action and cross movement building. So these are the kind of the five areas which we started to kind of surface and unpack last week. What that led to was like five very interesting bucket of questions where we're like, okay, what does this mean? What does this look like? And we propose these five areas of questions in these thematic areas for us to dive a little bit deeper in. So what does it look like for capacity and integration? That seems like such a big, vague area of work. It also seems like, okay, where do I even start? And so what we did was identify some key questions to start asking in this area. So like, what happens to your organization when you engage more closely with the formal health system? So these questions are designed to open up ideas, open up space, open up the imagination, and allow you to engage with these questions with your community. So with your organization, with your service providers, with people who receive your services, and really start thinking about how to deepen and refine these questions and possibly even come up with answers to these questions. And so those are the questions that surfaced last time. The idea was last week was really about surfacing kind of looking at the overall kind of design choices, and then start getting deeper into it with this week in between to take those 5 questions to your communities and ask them what they think about it. Because last week we had, I think it was roughly 50 odd people on the call. And of course, people don't want to speak for their entire communities. So having given the time of a week to go back, which I know is not a huge amount of time, but to at least confer with your colleagues, to talk to your communities and the people that you work with, to say, are these questions resonating? What comes up? Do you have any ideas? So that's what we did last week. Those are the questions we went away with for the last week. And now we're back to go deeper into session 2. So one of the things we decided to do for session 2 is to really hone in on these 5 buckets of questions. Today, we really want to dive deeply. And so the questions, okay, we're going to do something a little bit technically complicated now. So I do need you to pay attention and give me your full focus, because this is where all the wheels could fall off in terms of doing a session that is multilingual across the world, but also translation, but also deep breakout rooms. We know that we want to go deep. The problem is if all of us try and answer all of these questions in the very short time we have today, our discussion is really going to be quite vague and surface level. We also know that some of you are really passionate about kind of 1 or 2 of these questions and have deep expertise and knowledge and experience in that. So for us going forward, in the next session, after this, we're going to go and dive deeply into breakout rooms where we're going to discuss one of the particular questions. And so I would love for you to indicate in the chat, of this 1 to 5, please put 1 digit of the bucket of questions you are most excited about to get into today. So in the chat, just put one number. I know some of you are like, oh, 5. Okay, Abudu, you are winning. You're already winning. In if there was a prize for like top student, you are honored. You are interested in question 4. Great. Okay, we see what's happening here. So people are putting the number of the question that most excites them, because you're going to get a nice amount of time to really dive deeply in that one question. I know all of you would love to talk about all of them, but unfortunately, that's not able. And if you don't put the number that you're interested in, you're just going to be allocated to some random group. And we don't want that, because you might be like, you might know everything there is to know about strategic purchasing. And because you don't put the number 3 in the chat, you're then going to be talking about collective action and movement building, which is exciting, but maybe not as exciting as your expertise on strategic purchasing. So yes, we have all of them coming through. Okay. While that's coming through, I'm going to talk you through the process for Olga. Go ahead.
Just a reminder not to press on the join.
I'm about to do that's the so I'm going to talk you through the process while that's happening. So while that's happening, there's very exciting things going on in the back end. In the back end, we have people working like maniacs to make sure that you're going to be allocated to the right breakout room. That is only for the next session. So you're going to be getting a little pop-up that says, please come to breakout room number 3, number 5, number 2, or don't click on it yet. Only click on it when I am the holder of all power here. When I say join your breakout room, that's when you join your breakout room. Can I get a thumbs up for people who understand that I am the benevolent dictator in this situation? You have put your preferences in. What? Hey, lots of thumbs up. We have lots of people working furiously in the back end. For those of you who know Zoom doesn't play nice often, and is busy allocating you to the right breakout room while we're going to have this discussion now. And when I say go to your rooms, that is when you go to your rooms. Okay, I've got lots of thumbs up. People are clear. This is wonderful. We have good plan going forward. Okay, so while that back end is happening, luckily I'm not responsible for that. I can have a wonderful discussion with all you folk. I would really like to know from all of you, what are the kinds of things that you heard? I'm going to stop sharing my screen so that I can see some of your faces. That would be really, really nice. So I would like to find out from some of you what in the consult. Oh, wait, I can actually just change my gallery view. I want to keep those numbers up there just for people who are arriving late because there are lots of people arriving so that they can choose their numbers. I want to find out what are some of the things that you heard when you were engaging with your community. And I know a lot of you were really excited by the survey, but weren't given the opportunity, and life is crazy, and it went out on Friday, and today is Monday, and I understand the chaos. So I really just want to give us the next maybe 5 minutes for those who were not able to fill in the survey to click on the link that I just shared and to fill it in. It won't take you more than 5 minutes. The idea is you don't have to be an expert. It doesn't have to be beautifully written. It doesn't need to be poetic. You don't need to reference journal articles and footnotes and, I don't know, peer-reviewed research. It's just a set of questions to start surfacing, like, in these questions, what are some of your communities thinking? So I'm going to put the link here again. If you could click on that survey link, especially those, I know majority of you, I mean, there's 43 people on the call and about 10 people filled in the survey. So I really just want to give a chance because it's really important to get this information and make sure that the team has this depth of information when drafting any plans. So please, I'm going to give us five minutes where I will be quiet and you will be concentrating and you'll fill in the survey form. Okay, I'll talk quietly for those because there's a few people who just joined us. People are quietly filling in a survey. I'm sharing my screen. These are the 5 questions we're going to be talking about today and diving deeper into breakout rooms. I need you in the chat. There was about 3 or 4 people who just joined us to put in the chat 1 to 5. Which question here intrigues you the most? Which question are you most excited to dive deeper in today? You'll then get an invite into a breakout room, but don't click on it until I say you can. Cool, thank you. Number 3 and number 4. Great. Okay, 2 more minutes. I'm seeing the responses to the survey climb rapidly. This is fantastic to see. Okay, just one more minute, just for those who have just arrived. There was a couple more people. Just a reminder, if you haven't put yet what question you most want to delve into in the next session in the breakout rooms, please put number 1 to 5, correlating to these questions that are on the screen, because if you don't, then you are just going to be assigned into a random breakout room, and that won't make you happy. So please put that, and you're going to be allocated into a breakout room, and don't join until I tell you. Yes, Florence, to answer your question, you should be here. We aren't into breakout rooms yet. You'll have an alert that says you've been allocated a room that's based on one of the questions that you're excited about. I'll let you know in the next 5 minutes. We'll then go into breakout rooms. So don't click yes. You see, these are people who weren't listening to my instructions. You don't click yes. Those who will need simultaneous translation will remain here in plenary. So they won't be allocated a breakout room. Oh, Newton, laughing, laughing, laughing. I love a emoji. Okay, cool. So it seems like people have been able to fill out the survey. Wonderful. I just want to spend the next few minutes um, just finding out from those who were able to consult with their communities one or two things, like one insight that just really came up a lot. Do we have any volunteers of someone who was able to consult with their community and something that just came up and really, really struck them as like a really important insight? Feel free to put up your hand. And what I'll do is we'll make sure that the results from this survey, we make sure we'll circulate it after this call. So after this call, you'll get all these slides, the results for the survey, anything that we share, especially the content of the breakout room discussions. Okay, people are feeling shy and don't necessarily, they've said it already in the survey, they don't want to say it out loud. That is fine. Okay, so we're now going to slowly move into the next part of the session. And I know those who are here from the beginning are really sick of hearing these instructions from me, but I'm just hearing and I'm seeing the participant number shoot up, which means quite a few people have been joining us in the last 3 minutes. This is the last time I'm going to repeat the instructions because this is technologically very challenging and we want it to really work out and for everyone to be able to have the discussion in the group that they want to. So you are here with me. You have chosen what group you want to be on based on 1, 2, 3, 4, 5, whichever set of questions deeply inspire you that you were able to kind of really wrap your mind around and you really want to explore further. The team has now put you into breakout rooms based on that selection. If you need translation, you will remain in plenary to make sure you have access to simultaneous translation. Then, when we go into our breakout rooms, we're not going yet. You're only going to go on my instruction. There's a few things that we're going to talk about. So there's these 5 questions and these 5 buckets. There's 2 key questions you're really going to dive into in your breakout rooms. So based on the theme you've selected, what is the main change or longer term outcome you want to see for your communities in this area for the next 3 years? I want you for this part of the question to like project yourself into the future. You are in your community in 2030. What is the positive change that you have seen in your area, in your bucket of question? What is the positive thing that you have seen change? in the next few years. So I want you to really think about that and capture that. The second part of this is what are the three priority activities that are needed to achieve that change? So the idea is the first part of the question is making you think really big about like what is it you really want the outcome to be? But how do we get there? What are the practical, nitty-gritty, smaller solutions that we can do, the stepping stones to get to that major outcome? And so that's it. Those are the only two questions you're going to be exploring. You're going to be given 40 minutes and it's going to be smallish groups. So it's really time to like really delve deep into this conversation because last time we know there just wasn't enough time. So those are the two questions you're going to be dealing with. Couple of things. I recommend that you spend maybe 15 minutes on the first question and then the rest of the time on the second question. We don't want you to kind of spend the whole time on the first question and you get to the end of it and you're like, oh no, we need three activities. Um, so that's a recommendation. Another recommendation is there is going to be a little bit of feedback after your breakout room. So when we come back into the main room, we do really want to hear what has been happening in the other rooms. We know that in this group, there are also people that are excited about multiple questions. They would love to be in, like, I'd love to be in room 1, 3, and 5, but I can't. So there will be a feedback happening in the main plenary. Please, can you choose someone in your group who's going to do that? We don't want a situation when we get back into plenary and I'm like, okay, who from this group would love to share with us? And then begins the negotiation of, oh, who's going to do that? Are you going to do that? I'm not going to do that. You do that. So let's solve for that immediately and choose someone that is going to be giving the feedback to us because we really want to know the answers to these questions. Finally, when it comes to documenting, so what worked really well last time is what we do is we use Google Slides. I've shared the link here. And what it means, and don't worry, in your breakout room, there'll be someone that shares this link as well. And the idea is to capture it. So we know that there's going to be lots of interesting conversations, and we don't want that to get lost. So please capture all your thoughts. So by now, you would have been allocated into a group and we are ready to go. And so I would kindly invite you for the next 40 minutes. Go be free in your breakout rooms. We'll send you a reminder. Dive deep into these two questions. Please document, and we'll see you later for your feedback in 40 minutes. Enter, you may now join your breakout rooms. And those who are needing translation will be staying right here. Okay, please accept the invitation to join your breakout groups. Please put in the chat if you haven't received an invitation and which room you would like to be put in if you haven't received an invitation. Okay, we still have some people arriving. Those who are arriving, you'll see people are moving into breakout rooms. I need you to put in the chat. We're going into breakout rooms based on the themes of these five these 5 sets of questions. So to put in the chat which one of these sets of questions you're most interested in discussing. And you will be invited to that breakout room. Okay. We have a whole bunch of people who have just joined. Okay. Please, for those who have just joined, please, you'll see in the screen share that there are 5 different sets of questions. People are going into breakout rooms based on these sets of questions. Please put in the chat which question you would like to dive more deeply into, and then accept an invitation for that breakout room. Okay. Okay. Is there anyone having trouble going into their breakout rooms? Please put it in the chat so we know. And if you absolutely need simultaneous translation, then remain here in plenary and you form a new group. Okay. Yes, Cecile, please click join as in now. Yes, join. I see Olia is waiting for group invitation to group number 2. Okay, I see the rooms are filling up. Okay, on our end, everyone has been allocated into their breakout rooms. Please, can you click join? Okay, anyone having trouble joining their breakout room, please put it in the chat so that people know. Okay. Newton, it says you have been invited to room 2. You just need to accept the invitation. Okay, Dr. Ismail, let's see whether you have been, yeah, let's see. Okay, there we go, Dr. Ismail. You have been allocated. It just says you're not joined, so just look on your screen for an invitation to join a breakout room. Okay, welcome, Angie. Those who just joined us. I think there's been a flood of people who are coming late. We are currently, let me share again. We are currently working in breakout rooms based on particular thematic areas. If you see here, I've just put on the screen 5 different key buckets of questions that we've been discussing over last week's session and this week's session. If you can put in the chat which question you're most excited to explore. I think the breakout rooms have already started chatting about it. But can you put in the chat the breakout room from number 1 to 5 that you are most excited to talk about? Yes, and the ones that have stayed in plenary, can I just ask that for the next 30 minutes, we just leave whoever comes late as now, we leave them in the waiting room until this portion is complete. For those in plenary, the ones that are needing people who are needing simultaneous translation, I'm going to mute myself, and you are going to use this room as if it were your own. So please go ahead for those who are in this room.
Perhaps just give people a chance to pick the topic that they would discuss.
Yes, yes. So pick
I
the
saw
topic.
interest. Yeah, I saw interest in the chat for groups 4, 5, and 3. I think there were people. So maybe, as Ishra was saying, as if it was your group, pick a number and then you can go ahead. I'll be taking notes. I'm Pedro with the Strategic Initiative for Community Engagement.
Okay, just clarifying what Pedro said. So this group is acting as its own breakout room. So the people here are using simultaneous translation. So can the group here please, so this is its own breakout room. Please can this group vote over which question that they want to interrogate for the session? And then you can resume the conversation and decide on who you would like to report. Okay, Pedro, it seems to me as if I think people have been allocated. I think it feels like a lot of the people that are in this room may have stepped away from their computers or haven't been stepping into a breakout room. Can I just get an indication from who in this room here needs translation and is here to have the discussion on one of these topics, and who here does speak English and still wants to be allocated into a breakout room?
From my note, Hortensia and Dionisio are staying because they need translation in Portuguese. So Hortensia and Dionisio, you can unmute yourselves. And then from my notes, Wendy and Claude also stayed for translation. So if Claude and Wendy, if you're online, please unmute yourself so you can choose a topic. And Miriam.
Oui, merci, bonjour à tous. Donc, nous, on parle en français pour une interprétation dans les autres langues. Donc, Wendy, je ne sais pas si tu m'entends. Alors, vous me recevez.
Moi, j'ai bien reçu Claude. Sorry,
On avait choisi le chiffre 5 pour pour le sujet des droits humains. Et je pense que il y avait deux questions proposées, c'est ça?
c'est bien ça. Mais d'abord, je pense qu'il faut voir qui est resté parce que si c'est que vous, ça va être compliqué. Est-ce que Hortensia,
Ouais.
Wendy, Dionisio, Claude et Myriam, vous êtes en ligne?
Alors, moi, c'est Claude, je suis en ligne.
Oui. Myriam? Bon, Claude, je pense qu'on se retrouve tout seul. Hortensia, Dionisio, Nadia.
Boa tarde. Dionísio, nós estamos aqui e talvez eu convidar novamente a Hortência. Me parece não estar aqui.
Olá, Pedro.
Oi, Nadia.
Olha, desculpa, boa tarde a todos e a todas e obrigada por criarem este espaço onde possa haver a tradução. Eu só queria entender, como somos da mesma instituição e estamos no mesmo escritório, acham que é mais fácil a Hortência juntar-se à nossa sala ou é melhor ficar num espaço separado? O que é mais fácil, mais prático?
Acho que para nós é a mesma coisa.
Uhum.
Só seria importante, se vocês todos precisam de interpretação em português, então vocês podem ficar aqui na plenária. Tem o Claude, que é conectado também.
Uhum.
E então a discussão pode ser com vocês três, Claude, e se tiver alguém mais.
Está bem, acho que então podemos ficar no mesmo espaço, como fizemos o TPC de envolver as comunidades, os defensores que estão no terreno, e então eles têm perspectivas um bocadinho diferentes, e eu, em princípio, terei uma outra reunião. Então, vamos nos manter aqui em plenária e no mesmo computador para facilitar. E vão falando, contribuindo de forma alternada as diferentes questões, como têm perspectivas de diferentes grupos. Obrigada.
Perfeito. Então acho que somente é Claude e Dionísio e Nádia e Hortência que estão aqui. Mas podem começar então vocês a discussão com as duas perguntas.
Outro membro,
Claude, t'es toujours avec nous?
Oui, je suis là. Oui, je suis là, j'ai ajusté mon micro, désolé.
D'accord, pas grave.
Alors, finalement, qu'est-ce qu'on on retient?
Et vous avez proposé 5, c'est ça? Et Dionisio et Nadia, vous avez proposé quel groupe?
Oui, c'était le module droits humains. Il y avait deux questions à la suite.
Sim,
Et peut-être qu'on peut réfléchir
participação
sur
comunitária nas
número
decisões.
4.
4.
Eh, bon,
Alors, je constate que ceux qui sont dans le groupe personnel 5, on peut s'entendre, hein, on peut choisir de manière consensuelle euh, un chiffre, un numéro et puis voir ensemble, réfléchir. On est transversal de toute façon.
d'accord. Choisissons les quatre si ça vous va.
D'accord, c'est bon.
O quatro tá bom, Hortência, Dionísio e Nádia?
Sim, sim, está bom. Na
Tá, então,
participação comunitária nas decisões nacionais.
muito bom. Então eu vou me calar, vou só tomar notas, ok?
Não, eu só queria perceber, então, nós é que vamos facilitar é isso, partilhar as questões e as respostas, ou tem alguém que vai facilitar? Para além de nós três, só queria perceber.
Não, não tem alguém para facilitar.
Uhum.
Como é discussão, é mais discussão livre com vocês, os
Tá bem, obrigada.
as quatro pessoas.
Obrigada. Então, pronto, acho que este tema da participação comunitária nas decisões nacionais é relevante e tem, de alguma forma, a ver com aquilo que é a nossa visão, porque muito daquilo que é informação, incluindo de monitoria, liderada pela comunidade, que tem a ver com as barreiras de acesso aos serviços de saúde que nós recolhemos, na verdade, é para assegurar que os membros da comunidade e os grupos comunitários possam usar essa informação em encontros de tomada de decisão para poder influenciar as políticas e os sistemas. Não sei se preciso parar para a tradução ou posso continuar. Ok, perfeito. Então, nós o que fazemos é, tanto ao nível dos grupos comunitários, normalmente trabalhamos com organizações de base comunitária e com os comitês de saúde que integram os líderes comunitários, os líderes religiosos e também os grupos vulneráveis, como idosos, pessoas com deficiência, pessoas com HIV e outros, populações-chave e outros. Então, a ideia é fortalecer estes grupos, tanto em termos daquilo que são os direitos que as comunidades têm no uso dos serviços de saúde, mas também desenvolvermos a capacidade deles em termos de competência e habilidade e acesso à informação para participar nestes grupos. E mapeamos também juntamente com eles e com os serviços de saúde quais são os principais passos para influenciar a tomada de decisão. Então, na verdade, não é que foi assim um exercício tão fácil, porque no passado, mesmo nós, que somos uma organização da sociedade civil estabelecida, foi mesmo uma advocacia para poder participar nesses espaços e partilhar quais são as barreiras de acesso aos cuidados de saúde, quais são as violações e o que é que seria importante priorizar, tanto nos planos estratégicos do governo como no orçamento. Porque, na verdade, para eles era como uma afronta chegarmos e dizermos que há violações ligadas à falta de privacidade, maus tratos, cobranças ilícitas, principalmente em espaços onde estavam habituados a falar-se só bem do governo e dos serviços prestados. Então, normalmente são os conselhos consultivos, que é quando o governo deixa a base, que é as comunidades junto aos serviços de saúde, para ouvir aquilo que são as preocupações, as reclamações e as sugestões das comunidades. E um outro espaço são encontros do PES, que são os encontros de planificação económica e social, onde nós usamos aquilo que são as lacunas do sistema, como, por exemplo, se não tem ambulância, se não tem medicamentos, se as infraestruturas estão degradadas, se não há equipamento para medir, por exemplo, a carga viral ou para fazer hemograma, e trazemos a realidade, porque às vezes, normalmente é feito de forma mecânica e às vezes olhando para aquilo que é prioridade por parte dos trabalhadores de saúde e do sistema e não a voz da comunidade. Então, o que nós fazemos é assegurar que estes membros da comunidade, quer como pacientes, que é a voz do paciente, mas como também através deste grupo mais organizado, que são os comitês, que sejam eles a falar. Normalmente até nós damos um pé para trás e deixamos eles à frente para serem eles a partilhar quais são as prioridades na perspectiva do paciente e da comunidade. Então, são estes encontros de planificação económica estratégica, porque, na verdade, estes encontros culminam naquilo que é o processo de orçamentação das despesas do Estado. Então, pronto, é a perspectiva de trazer a voz do utente e destes grupos comunitários para estes encontros onde tem a voz do paciente. Agora, há um nível um bocadinho que ainda não conseguimos, na verdade, trazer a voz da comunidade diretamente, e sim através de nós que somos da comunidade, mas através de institucionalizados, né, de organizações da sociedade civil. Então, nós já fazemos isso através dos grupos técnicos do Ministério da Saúde e de outras, do Ministério da Justiça, do Ministério do Trabalho. Então, participamos nestes grupos ao nível do Ministério, ao nível do Distrito e a nível das direções provinciais de saúde, e é através destes grupos que conseguimos influenciar a elaboração dos planos estratégicos do Ministério, as políticas, as diretrizes nacionais e o orçamento, partilhando, pronto, aquilo que é a voz, aquilo que são os dados que nós encontramos, tanto qualitativos como quantitativos, ao nível do nosso trabalho. Então, acho que em relação, para não monopolizar, a primeira questão é essa. Primeiro mapeamos ao nível da comunidade as pessoas-chaves, capacitamos essas pessoas-chave e envolvemos no processo de auscultação comunitária daquilo que são as necessidades para dar voz ao utente e, ao nível também do governo, mapeamos quais são os passos relevantes e fazemos advocacia para assegurar não só a nossa participação como sociedade civil, mas a participação destes que são diretos na comunidade e depois tentamos trazer, através de testemunhos e através de dados quantitativos e evidências do que é que nós recomendamos em termos de prioridade, quer seja em termos de recomendações para melhor funcionamento do sistema, por exemplo, coisas muito simples. Temos déficit nas unidades sanitárias de provedores de saúde e não dividiam as consultas por grupos de horário. Por exemplo, das 8 às 10, consulta da HIV, das 10 às 15, estou a dar um exemplo, só consultas de tuberculose. E como temos déficit de provedores e déficit de espaço, havia muita demora no atendimento e havia pessoas que não chegavam sequer a ser atendidas quando estavam desde as 5 da manhã a formar fila nas unidades sanitárias. Então, com esta recomendação para dividir o atendimento ao público por agendamento ou por dividindo o atendimento, por exemplo, foi uma forma muito simples, que nem requeriu custos, mas de assegurar o atendimento mais rápido e que não houvesse perca de pacientes. Então, isso era só para dar um exemplo simples de como o influenciamos, que depois há uma política que orienta que a todas as unidades sanitárias a nível do país, recomenda-se que caso haja problemas de espaço, problemas disso, o atendimento seja feito por blocos ou por agendamento, não é? Isso é um exemplo, mas temos muitos outros, mas como não sei como está a questão do tempo, pronto, vou passar aos meus colegas
Talvez,
para falar das outras questões.
sim, obrigado. Foi a Nádia que falou?
Sim, foi a Nádia que falou e estava mais na questão relacionada a quais são os passos nacionais de tomada de decisão mais importante. Conselhos consultivos, com encontros de planificação económica e social, conselhos de direção ou encontros de conselho coordenador do governo aberto à sociedade civil e o último, temos também diálogos nacionais inclusivos, que é com o governo e com a sociedade civil. São mais ou menos, e os grupos técnicos, a nível das diferentes direções do governo, grupos técnicos de trabalho. Estes são limitados à participação apenas de organizações da sociedade civil estabelecidas, estes últimos grupos técnicos de trabalho. Então, iria passar a palavra ao meu colega, à minha colega Hortência.
Talvez
Hortência,
antes de passar, talvez, não sei, eu vejo que o Claude já não está na chamada, mas talvez tem outras organizações que querem participar.
tá bem, desculpa. Eu pensei que fôssemos
Bonjour à
só
tous.
nós, estou a ver agora 21 participantes. Muito
Je suis
obrigada.
Madame
Desculpa.
Myriam. J'aimerais savoir, euh,
Merci Myriam. Vas-y, allez-y.
oui, j'aimerais savoir si nous qui sommes restés en plénière, nous avons choisi quel sujet, parce qu'à un moment donné, ma connexion a coupé.
On est sur les sujets de participation communautaire, engagement communautaire, donc le sujet 4.
Allô?
Oui, on est sur le 4. Est-ce que vous voudrez rajouter quelque chose? Je ne sais pas si
Allô?
vous avez entendu. Oui, vous nous entendez, Myriam?
Ah, la question 4.
Oui. Vous voulez rajouter quelque chose?
Oui, je voulais dire quelque chose par rapport à ça. Premièrement, moi, je suis Madame Myriam Baya, chargée du programme de l'organisation Focus Droit et Accès basée en RDC Goma. Alors, je voulais revenir sur la question liée à l'engagement communautaire dans les décisions nationales. Dans notre contexte, en tout cas, ça n'a pas encore été effectif, hein. Du fait que de notre côté, en tant qu'organisation communautaire, nous avons fait de notre mieux pour que les communautés, les femmes et les filles touchées par les VIH-Sida, le paludisme et la tuberculose puissent participer dans les instances de prise de décision au niveau local. Et quand je parle de niveau local, il s'agit bien évidemment des structures de prise en charge, les centres de diagnostic et de traitement, ainsi qu'au niveau de la zone de santé où nous faisons participer nos bénéficiaires dans les assemblées générales organisées dans ces instances. Alors, dans les 3 prochaines années, nous aimerions vraiment que cette prise de décision, cette participation soit vraiment effective, que les personnes touchées participent, surtout au niveau de la province, au niveau de la division de la santé, qui est une cellule qui accompagne les personnes touchées, qui prennent en compte leurs besoins et qui est aussi un mécanisme de feedback par rapport aux services rendus. Mais aussi, au niveau toujours de la communauté, il y a encore aussi ces besoins d'ignorance ou de manque d'information, si je peux le dire. Il y a plusieurs personnes touchées qui ignorent encore quels sont leurs droits. Et donc, de notre côté, nous renforçons cette communication, éducation, sensibilisation, information des personnes touchées sur leurs droits et les moyens de le revendiquer en leur faveur et en faveur des autres groupes marginalisés. Mais nous voudrions vraiment que les personnes touchées participent au plaidoyer en ce qui concerne leurs droits à la santé, surtout au niveau de la province, au niveau donc national et au niveau du ministère de la Santé. On aimerait vraiment que cette participation soit effective. Merci. Telle est ma contribution par rapport à la question.
Merci beaucoup, Myriam.
Allô?
Oui,
Oui, merci. Je suis donc Alain
Claude, vous êtes
Claude
là.
Kra.
C'est bien.
Oui, Monsieur
Oui,
Alain Claude Kra de Côte d'Ivoire. Je suis consultant en CRG. C'est vrai qu'actuellement, je ne gère pas un programme, mais dans les années passées, par mon positionnement et la connaissance des programmes du Fonds mondial et surtout de la participation communautaire. Je vais juste ajouter une recommandation sur ce que les collègues ont déjà dit, qui est le même cadre d'intervention aussi en Côte d'Ivoire pour la participation des communautés, pour le CLM, pour la collecte des données avec des collecteurs. Sûrement que pour les 3 prochaines années, il faut systématiser le plaidoyer. Alors, connaissant l'environnement, il y a peu de postes de techniciens plaideurs au sein des réseaux, parce que finalement, ce sont les organisations des communautés regroupées en réseau qui centralisent les données et les recommandations des communautés. Mais au sein des réseaux, jusque-là, le plaidoyer se fait de manière en s'appuyant plutôt sur les directeurs de réseau, sur les coordonnateurs de programmes prévention ou prise en charge, mais il n'y a pas, n'est-ce pas, de titulaire de postes et de tâches de plaideur. Alors que l'approche fonction permet de renforcer la technicité du plaidoyer et l'inscrit dans un plan de plaidoyer. Donc, c'est vrai qu'on est en période de raréfaction, diminution des ressources, mais si on veut, à partir des données des communautés, avoir un plaidoyer qui aboutit avec des résultats, il faut titulariser, il faut institutionnaliser des postes de plaideurs au sein des 3 ou 4 réseaux qui rassemblent les communautés. Donc, c'était vraiment une de mes recommandations fortes pour soutenir la participation communautaire. Merci.
Merci Claude. Je note l'intervention et le rajout de ce point. Est-ce qu'il y a d'autres personnes qui n'ont pas parlé dans ce groupe de plénière? Non, dans ces cas-là, peut-être maintenant, oui, je veux bien passer la parole à Dionisio ou bien Hortensia, si vous voulez rajouter quelque chose sur le point de Claude ou de Myriam ou de Nadia.
Bom, boa tarde mais uma vez. Aqui Hortência, na Mata Moçambique. Bom, uma vez que a Nádia já havia iniciado, falou um pouco sobre os espaços nacionais de tomada de decisão que são mais importantes. Eu gostaria aqui a falar um pouco sobre onde a voz da comunidade é mais forte e onde é que é mais fraca. Bom, com base na experiência do terreno, temos identificado que a voz da comunidade é mais forte quando eles participam nos encontros dos conselhos consultivos locais, porque é lá onde tem mais participação dos membros, da comunidade. Por outra, é onde se envolve mais a comunidade nesses conselhos e local. E tem mais, a comunidade tem mais espaço em termos daquilo que é o diálogo comunitário. Também verifica-se a presença da comunidade no que tange a responsabilidade do próprio governo em coletar aquilo que são as ideias da comunidade. E verifica-se também a fraca participação, principalmente quando os encontros são provinciais ou a nível nacional. Quando é a nível provincial, há pouca participação ou influência da própria comunidade, não é muito envolvida nesses encontros. Geralmente, os decisores é que lideram os encontros e não dão voz à própria comunidade, porque a comunidade não está lá, nem um representante da comunidade. E isso tem fragilizado bastante aquilo que são as preocupações
e da própria comunidade, quando eles não são envolvidos na província nem a nível nacional, porque esses são os níveis macros onde são selecionados, são priorizados as barreiras da comunidade, ou aquilo que são as preocupações da comunidade, elas são mais priorizadas nestes níveis provinciais e nacionais. Porque é lá onde se discute também a questão do orçamento, desta planificação, discute-se o orçamento, são níveis que, na verdade, há muita limitação ou da própria comunidade para eles participarem nas definições da planificação orçamental e para responder àquilo que são as suas necessidades em relação às dificuldades que eles encaram nas unidades sanitárias. Tem várias barreiras, na verdade, que se não forem priorizadas a nível da província ou ministério, eles podem não serem respondidos. Por exemplo, questões que têm a ver com infraestrutura, não tem casas de banhos na unidade sanitária, tem casas de banhos precárias, não tem equipamentos. Então, esses desafios, se não forem priorizados no PES, eles levam mais tempo para serem resolvidos ou mesmo não serem resolvidos. Olhando para aquilo que são as necessidades da comunidade, serão essas barreiras que seriam priorizados no PES, mas porque a comunidade não foi incluído neste processo, as barreiras ficam por detrás e não são resolvidas. A comunidade vai sempre reclamar das mesmas barreiras anualmente. Então, o que nós, se calhar, podíamos recomendar é que estes membros da comunidade, ou comunidade, seja comitês de saúde, membros influentes da comunidade também sejam incluídos nesses encontros provinciais e nacionais. E, por outro lado, é preciso também que haja este fortalecimento dos comitês de saúde ao nível da unidade sanitária, distrito e província. Que isto é para garantir que os comitês não sejam limitados apenas na promoção de saúde, mas também que tenham um papel ativo naquilo que são as suas inquietações ou preocupações e que também haja essa defesa dos direitos e monitoria da qualidade dos serviços de saúde. Então, não sei, Dionísio, tinha alguma coisa por acrescentar?
Bom, muito obrigado pela cedência da palavra, e também por participar deste debate sobre o envolvimento comunitário. Estou acompanhando aqui as várias imagens dos quadrantes do mundo e como é que é feito o envolvimento comunitário. É apaixonante ver como as estão sendo envolvidas nas áreas, como podemos fortalecer esta componente de envolvimento comunitário. Na verdade, uma das coisas que me ocorre quando nós falamos de envolvimento comunitário é um envolvimento de fato real, efetivo, não imposto. Muitas das vezes o que acontece, falamos de envolvimento comunitário, mas quando procuramos perceber em termos daquilo que são as políticas, as ações que os governos e, sobretudo, nós que atuamos na área de saúde, são implementados a nível da base, não resultam daquilo que, de facto, são os consensos ou a auscultação ou a voz da comunidade. São decisões que resultaram de um desenho num escritório. Sim. Não sei ao certo o que estaria a acontecer, ou talvez seja o dispositivo que tem algum problema. Mas eu estava a destacar a importância do envolvimento comunitário, e de fato é uma área extremamente importante na materialização de qualquer programa ou de qualquer iniciativa. E temos um desafio enorme em que muitas das vezes as ações ou as atividades que são desenvolvidas ao nível da base ou os planos que os governos executam não resultam daquilo que, de fato, é a necessidade real partilhada pela comunidade. Na nossa experiência como na MAT, ao nível da base, existe uma ligação muito forte entre estruturas locais e as comunidades, em que, através de diálogos comunitários e outras iniciativas de auscultação, é possível recolhermos sugestões, iniciativas e reais necessidades da comunidade. Quando passam para outros níveis, percebemos que, à medida que passam do distrito para a província para o nível central, há uma tendência de filtrar aquilo que são as reais necessidades da comunidade e perde-se, o que muitas das vezes resulta em implementar programas que não respondem às reais necessidades da comunidade. O que temos feito? Uma das ações que temos feito ao nível da base é assegurar que, se é um distrito, criarmos um comitê, não é, distrital da comunidade, que vai participar no fórum distrital do governo para assegurar que as suas preocupações, as suas sugestões, as suas reais necessidades sejam refletidas na planificação do governo. E também temos procurado, a nível provincial, influenciar no sentido haja comitês provinciais que vão fazer acompanhamento a nível da província daquilo que são as sugestões, são a partilha das necessidades da comunidade, porque percebemos que só desta forma podemos, não é, influenciar e assegurar que os governos assegurem esta componente de participação real das nossas comunidades. Então, são esses acréscimos que eu queria trazer em relação a este tema que estamos a discutir sobre o envolvimento comunitário. Espero que a minha voz tenha ficado melhor e over.
Thank you so much. Just to say, all the breakout rooms are closing. In 9 seconds, everyone will be joining us back in the main room. And then we're just going to have some sharing of the different groups. So we'll start and go with them in order. And I know this plenary group chose number 4. So I'll call on group number 4 to share their insights. Okay, everyone's coming back. Okay, I know that was 45 minutes. I know it didn't feel like very long, but it was very long. I see by your note taking that you managed to get really deep into the discussion. I also see by your note taking that a lot of you went a bit rogue around the 3 priority activities. I don't think one group have 3 priority activities. In fact, most groups have pages and pages of activities, but more rather than less. I know it was a great discussion for a lot of you, and I know there's a lot of us who wanted to be in on all the discussions and that we couldn't be because we had to choose one to go deep in. So we're going to spend the next 30 minutes or so hearing a bit back from each of the groups. So I'd like each group, I'll call on each group to share very quickly. You're going to get, and I'm going to cut you off. I'm going to be that kind of facilitator where I'm going to cut you off after about 4 minutes because we really want to listen to each group. And I really want each group to share especially the answer to those 2 questions. So the main change you want to see for your community in the area in the next 3 years, and what are the 3 priority activities needed to achieve that change. So if you just tell us those key things and just give us some insight into the discussion that your groups have had. So I think the best way to do this is to go in order. So let's just start with room 1. So that was capacity and integration. I even know who was in that room. That was Kate, Anthony, Ghana, Isaac, Olga. Who has been the chosen one for that group to share a little bit about what you discussed?
Yeah, I am the one.
Please go
Yeah.
ahead, Isaac.
All right. So basically in our group we discussed we had discussion around the integration and one of the key things we look into was how integration can actually be with autonomy for communities when the idea and the goal of integration is fully actualized in our community. Because we discuss having an integration where communities not just being absorbed into the system, but they are able to be recognized as a partner a sort of an essential health system. And then we had other discussion around how we need to also look at the services within the integration and how it shouldn't be used as a weapon to criminalize community members, right? So also we look at how to avoid services being diluted as one of the main goals we need to achieve within the integration discussion. Also, to look at some of the three main priority activity we would want to do. I think we have four, but I can only remember three from the discussion, and I can't find this slide now on my screen, right? But for the three I could remember, I think one key thing we mentioned is that there's a need for a standard guideline that would define what good integration really looks like for community perspective. What does the governor or stakeholders or funders needs to put in place if they really want to integrate community services into what they do? And then another very vital point that was raised or activity was how community-led monitoring services and involvement of community organization is written in real national legal documents in countries, right? So that we can have a guaranteed package of services. And the third point is around practical capacity building for the PRs, FPM on what is country ownership, also the Ministry of Health and the country government as a whole. I think the person made the point that the Ministry of Health and the country is not the same. And so decisions should not just be housed in the Ministry of Health, and we need to involve community in meaningful ways where decisions are being made within that ecosystem. I think the third point, if Gianna would just want to mention that quickly. Thank you.
Okay.
Yeah, Ghana, do you want to mention the fourth point? Thank you.
That's more about it was about CCM involvement and clear working, because everything written about CCM, it's really good platform to involve in the community involvement in developing the integration systems. But if they are not working properly, if they are only created in countries for Global Fund to approve application and that's it, and that then it will not help. That's actually was my point. And that's why we need to ensure that CCM itself is integrated into state system of making decision.
Thank you so much. Can we use this group as an example about feeding back? You guys win the prize. That was a wonderful summary of your discussion, and especially the kind of 3/4 priority areas that you have for your questions. I'd love to then follow on with question 2, alternative financing. So Anna, Dr. Ismail, Ivan, Nana, Newton, Euler, Oscar, Sergio, who is going to talk on behalf of your group.
I think we failed the first task, Ishtar, in terms of picking a rapporteur, but I am going to take the liberty of nominating Sergio and Olga. Olga can add in some extra to support.
Okay, good. Well, let's see. We have the notes for our discussion that was focused on alternative financing. We had a really good discussion. We discussed, well, I mentioned a little bit of the case of Paraguay that is entering transition, and we're mentioning about priorities that also need, most of the interventions that we are leading, for example, as also in other countries, are very focused on the health sector, but there's a lot of need to also sustain our advocacy work. We mentioned, let's see. Yeah, we need to also, Olia can also add in something that I may be missing. Also, Nana mentioned about the social contracting that are happening, the pilots that are happening in countries are not yet to scale, and the programs will need to be implemented with fidelity. There was also discussion about the restrictive environments in some countries, in some regions that are hardening the work of organizations, basically for registration and also to continue doing the work as NGOs, for example. I mentioned the case of Paraguay that entered into this new legislation since 2024 that is really making our work hard. Many of the programs that are shared, let's say, in responsibility with the Ministry of Health, often say that the community involvement don't really add value or generate impact. And that's really hard to make the advocacy case for our work to be sustained through state-sponsored programs or collaborative work with them. Some of the priorities that we mentioned is that we need to do analysis on mechanisms that are now being implemented or that need to be implemented as we enter into the transition. We also mentioned peer-to-peer support and learning exchange on financing models and impact of communities. On a personal note, I hear a lot of the, even from the first group, I hear a lot of the similar cases happening as in Paraguay, in Uganda, in Peru, in a lot of countries. So it's really good to have this discussion and this even as a learning experience that is among peers. Also, engaging local and traditional leaders, drawing experts from community. We had a discussion and a couple very informative links from the malaria example from Uganda on co-financing mechanism. We also discussed the public-private community or alliance. In Paraguay, for example, in Spanish, we call it Alianza Público-Privado, that is a private-public alliance. Under these type of alliances, we are trying the pay for results model that is now being implemented under the Global Fund grant that we have in Paraguay. So basically, organizations entered this pilot a couple of years ago, and now it's more like a formal exercise during our last cycle that we are only gonna get paid as we achieve results that are responding to health indicators. But often the discussion that we are leading locally is that most of the work or the work that we have to do to reach those results often costs a lot more than what is currently being paid and what is currently being budgeted for. So we're always going to have a gap, not only to achieve these results that respond to health indicators, but also to support our core services, for example, to keep the lights on and the doors open, as we say. So that's going to be increasingly hard as we move into this transition era. And again, because the government doesn't really see a value in our work. Just a couple other things. Olia, if you want to step in also to mention the CLM programs. And I mentioned just briefly that something that is happening in Paraguay is that we are being advised to create new enterprises that are private enterprises that are community-led. So basically constitute the same board of directors for a private entity that can be a service, a private provider for the state or for the Ministry of Health, for example, because they will not hire an NGO that is called Somos Gay, in our case, that has a gay in the name. So yeah, I will stop there and thank you, Olia. Or if I miss anything, Anna or anybody from the group, yeah, I think that was the summary of our discussion.
Yes, thank you, Sergio, for your presentation. It was full information what we discussed, but something a little bit about CLM and communities, what was from my side. First, that CLM program is biggest risk with transition plan because it's impossible that countries realize transition plan and including after 8 cycle CLM programs for community because they have big challenges for today's
today regarding with medical transition plan, with social support transition plan, and we are not sure that they have place somewhere of include to governance funding some monitoring programs for communities or human rights. And one of proposal was a discussion how we can provide some second transition plan from CRG department for CLM programs for countries who for whom aid cycle will be last. That idea that for governance, aid cycle is last, but for CLM program for communities, Global Fund provides some transition next plan for 1 for 2 years for support them for next dialogue with governance after main transition plan for transition plan, build this bridge for communities. Second idea was that it will be good if with main strategic from CRG, we can clarify plan for TB community, for HIV community, for malaria community, example, for vulnerable group, because every community have different goals, different plans, and different timelines. And it would be really great if Global Fund Strategic will support global goals and try to support, try to help unite profile community for their global goal. For example, if in TB, I can speak about TB because I represent TB people global, and I'm sure that for other communities, the situation is the same. We have global goal 2030, and for our understanding, all communities program, including human rights, CLM program, stigma, and access to treatment and support should support community and help support provide realize implementation programs to global which come us to global goals, and for every community we should have separate mini strategic which orient for needs these communities. And I think it will be really practical and helpful for every community, understanding how they can participate and with which ideas and programs they can participate in this funding. For next slide.
Olia, can I just ask you just to wrap that up, just so we can have enough time to get to the other groups?
Sorry, I'm finishing. Last but not least, that we should think how we can. We understand that we need build some new mechanisms, some new try to find new approach and way. But we also should think how we can save mechanism for funding what we have today and what was effective for communities, and for we need to analyze this mechanism and try to find a way to support them, and also CFCS for TB community, which is important for us. Thank you, and sorry for a long time.
Thanks so much. Awesome. Okay, can we go on to the next group, which is CLM for strategic purchasing? So that's Dinosaur, John, Michelle, Mokam, Retziletso, and Susan. Who is the chosen one?
I guess I will be the chosen one. This is John, tuning
Go
in from
ahead,
Nairobi.
John.
Hi, everyone. Okay, so can you hear me? I hope I'm audible enough. Perfect. So
Loud and clear.
So for the next 3 years, what we thought we should see is one, integrated CLM systems. So we don't want to have TB, HIV, malaria, SRH, all those small CLM mechanisms working in one country. We want to see one unified integrated CLM mechanism that can coordinate across the public health and other related sectors. So the second thing that we wanted to see is that we want to see fully empowered communities, because the way CLM is being implemented currently is that there are bigger NGOs that are designing and working with the smaller NGOs at grassroots level to implement CLM. But in the next 3 years, we want to see that communities themselves really at the grassroots level doing all the work from A to Z. So the third thing that we wanted to see in the next 3 years is that we want CLM data to be fully recognized as the official source of data for health planning, resource allocation, and program improvement. So currently, CLM mechanisms are implemented by NGOs, but they are not recognized. The data is not recognized as a source of data for health planning. So we want to see that happening in the next 3 years. The next thing we want to see CLM contributing to quality service. Yes, that is what we want to achieve. 7 maybe, but we still think maybe we'll miss that mark, but we want to see CLM contributing to quality health services, especially for most vulnerable key populations and more risk populations. We want to see, again, this is also maybe we should achieve it now, but we think we'll miss the mark. So we want also to see accountability that has been enhanced through CLM. Then the other thing, what we want to see in the next 3 years, we want to see legal changes actually informed by CLM data. CLM data to inform legal changes and policy changes, especially protecting human rights across the board. We also, the last thing that we wanted to see in the next 3 years is the sustainability of CLM at community level. How is CLM sustainable? Just recently, we've seen CLM mechanism closing down because of some donors pulling out. But how can we ensure CLM can go beyond the cycle of donor funding so that they are more sustainable, they can live and outlive and outgrow the programs that initiate them? So what do we do to achieve this, all this? The first thing we wanted to see is we want countries to establish, develop and implement CLM frameworks that can guide design and implementation of CLM activities in a country. National CLM frameworks that can provide that kind of leadership, establish some sort of structured way of doing CLM in any country. We also want to scale up education and capacity building on a number of things, advocacy, because CLM data, somebody needs to do advocacy around CLM data. Do we have the advocacy skills? We also want to see capacity building in budgets advocacy. Communities need to be able to track budgets, need to know when budgets are done, how to do this. But they are armed with what? The CLM data to be able to advocate for those budgets. Know your rights issues. We want to see the CLM. These are the activities that we want to do. So the one activity, another activity is the capacity building. Let's continue building capacity training and strengthening communities to be able to apply CLM data. The next activity we should do to be able to achieve the above is that advocacy of policy reforms. We need to scale up advocacy and advocacy across board, because we remember during the reprioritization, advocacy was deprioritized for community interventions. So can we reprioritize it again to ensure that advocacy is there so that at least people can use CLM data and have finances and resources to do advocacy across the issues that we want to do. We wanted also to implement activities around quality assurance. How do we implement activities that target to quality assure the data that is generated through CLM? We have been blamed all the time that community data is poor quality. We appreciate that. So we need to have activity that's targeted to strengthen the quality of CLM data so that at least we are not blamed for poor quality data that comes from the communities. We also wanted to, the last activity that we want to, I think this relates to the last, the advocacy activity that I mentioned. We want to see that the activities that need to be done is to ensure that scale up advocacy for also sustaining CLM, and also to ensure that communities are actually recognized at a planning resource allocation level because they are armed with the CLM data. So in case I've missed everything, it was a bit difficult to take the notes, but I hope I have represented the group. My group members, please, if I've missed something, I'm sorry, please just jump in and correct me. Thank you.
John,
I hope we won. The first time you said the first group won. So we were trying to change that narrative.
Okay.
I hope we won.
I'm reassessing, and I use my power as facilitator to say, I think John did his group proud. I'm seeing lots of claps and lots of hearts. So I must say, I'll use my bias and say this group is definitely in the lead. Whoa, you are just getting a lot of love. So clearly you said a lot of smart things. Amazing. And so let's follow up with the next group. So we had two groups that actually did question 4. There was a group that was in plenary as well as a group where we have, let's see, community engagement. Yes, there we go. Abudu, Annabelle, Fidel, Florence, Gavin, Nekula, Olga, Talin. Who is the chosen one from your group?
Abudu is the chosen one.
Hey, of course. Okay, let's see if you can beat John. Go ahead.
Oh, I don't think I can beat John. So in our group, we looked at the 4th puzzle, and then we came out with our solutions. The first thing is that we want to institutionalization of community engagement and government commitment. We want to make sure government and national programs should formally integrate community networks into national HIV/TB malaria planning, budgeting, implementation, and monitoring structures. Communities should have permanent representatives at the CCM, national budget, national disease control, health sector, and at the primary health care level. That's the first issue. The second issue is I want to build community level mechanisms that support engagement, such as community evaluations and then meetings. Thirdly, we want to strengthen community engagement in countries with accelerated transition, including in non-CCM countries, such as coordinating committees, and then likely matters. And I want to urgently reactivate CCMs and non-CCM decision-making bodies in preparation of global fund transition. Then also we need real power and resources for communities, particularly the KVP population, and then to participate and influence and co-create some of the programs at the national level. And then also want to use the Global Fund diplomatic voice to use the Global Fund diplomatic voice and relations such as UN partners to position the importance of CESI at the country level. So these are the areas that we think the main change is needed. And then how do we achieve this? We look at direct, flexible, participatory funding for advocacy, service delivery, and then CLM. Also, we want to ensure there's participation in co-creation of global fund priorities, implementation plans. Then also, there's a need to generate community-led data and CLM to support whatever programs you have, so you can speak from informed decision and make sure whatever suggestions that are put forward have the backing of data. Then also there's community capacity building. We want to build the capacity of communities in areas such as policy advocacy, budgeting, and then knowledge on different pathways of engagement, such as the UHC, Global Fund, and then other implementing new partners or for new CCM members. Then also want to support existing platforms, or we launch new platforms where they don't exist for coordination, for collaboration between communities and national programs. Then last but not the least, we want documentations that add value of community documentations that would add value of community engagement in decision making, sorry. And then also we want to develop community tools on how to engage at the national level. So basically, this is what we have. I don't think I'm able to match John, but this is what we have at Group 4. Thank you very much.
Thank you so much. That was great feedback. And you did get claps and thumbs ups. And so I don't know, it's gonna be a close one. So thank you so much for that feedback. Oh, loads of claps. So I'd like to call the other group that also did question number 4, and that was the group that was in plenary. So they self-assigned and chose community engagement number 4. So who would like to present on behalf of that group? I see you have documented on the slide number 7.
The pressure is too high now. But I'm wondering if Nadia or Claude would be willing to present.
Allô? Oui, c'est vrai qu'on n'avait pas désigné de... Attends, je vais essayer de mettre la vidéo. Je suis dans un bureau. Voilà. On n'avait pas désigné de rapporteur, mais je vais essayer et puis Nadia va compléter quelques points. Je vais commencer d'abord par ma recommandation. On avait discuté de comment optimiser justement la participation communautaire pour lever toutes les barrières d'accès aux services. Donc, on a beaucoup fait le tour sur le CLM, sur la nécessité d'implication de plus en plus des communautés et sur leur reconnaissance. Et une des deux, j'ai retenu 2 recommandations. D'accord, c'est bon. Voilà. Attends que je désactive. Oui, c'est bon. Vous m'entendez mieux? Je pense c'est vraiment un problème de connexion ici. Vous m'entendez mieux? Allô? D'accord. Donc, l'une des recommandations pour optimiser le travail des communautés et de permettre que le plaidoyer puisse aboutir, c'est de promouvoir l'approche fonction. Promouvoir l'approche fonction, c'est-à-dire qu'il faudrait qu'il y ait un peu plus de professionnels du plaidoyer, des techniciens au cœur, au centre des réseaux thématiques qui coordonnent le recueil de données, par exemple, dans le cas du CLM. Parce que jusque-là, ça avait été constaté, en tout cas pour notre expérience pays, que il y a le recueil des données, il y a des agents de collecte, par exemple pour le CLM, mais après, pour le plaidoyer, c'est généralement les présidents d'organisation, les directeurs d'organisation qui n'ont peut-être pas forcément la technicité pour conduire le plaidoyer. Et une des propositions, c'est qu'il y ait des postes avec des tâches spécifiques du plaideur pour pouvoir conduire cela. Une autre des recommandations, c'est que on favorise la participation effective des communautés. Et là, c'était notre collègue de Goma qui avait fait cette proposition et que les communautés se sentent vraiment engagées et valorisées dans tout ce qui est participation communautaire. Donc, voilà un peu ce que j'ai pu retenir. Je ne sais pas si les autres collègues peuvent ajouter quelque chose.
Okay. Wonderful. Thank you so much. And now we're handing over to the last group, which is about collective action and cross-movement building, who I counted at last count had 18 bullet points for what they think the top 3 priority activities are. So Whoever is going to be presenting for group number 5, I am so keen to hear who has been chosen between Alexandrina, Angie, Cindy, Maria, Michael, and Vitali.
I have been volunteered. Hi everyone. So yeah, we had a small group, but really interesting discussion. I will try to sum up, and thank you, Alexandrina, for also for the notes. And I will list not in the order of priority, but that I think as we had the discussion. So one of the change we would like to see, of course, it is achieving more meaningful participation for women and girls. And I think this is one of indicator for the whole Global Fund partnership effectiveness. If women and girls will be represented meaningfully in the decision making, so that would lead also to better uptake of indicators on stigma, discrimination, and gender-based violence in general. Why support the cross-movement building is important. Intersectionality, as we know, is a must. We cannot do without mutual support. But also, it is important, especially in current situation, to mind the divide that is already developing between different communities, where, for example, funding is leaving the communities at different space, or some communities, for example, as trans people are regarded as maybe not desirable or associated fears with this specific community. So one of the change that we would like to see by the end of this cycle is to reduce this divide between the communities. We already, of course, mentioned leaving the situation of the transitioning for many countries and regions, especially Eastern Europe, Central Asia, Latin America, and the Caribbean, maybe Asia and Pacific. So, but the cross-movement building, our cross-movement is already there. So we need to protect gains, so that we would like to see from the Global Fund that the gains and experience already there in cross-movement actions is supported and is not lost in 3 years or even after the Global Fund will leave the regions and the countries. In terms of the current grant making, of course, the change should be, we need to, not the change, I think it's obviously always there, but we need to mitigate the risks related to integration, especially of underserved populations. So we need to think before it happens, especially now at this stage of funding request development. Monitoring and accountability of the Global Fund grants in dismantling human rights barrier is important, especially as integration is moving forward, as it's increasing pace, and we will have less community PRs and also community subrecipients. So how do we make sure that these human rights standards are adhered to even in official or formal healthcare system? And responsible transition is a must for all of us, for 38 countries in this grant cycle, for 12 countries in the next cycles. It is but also for all the rest of the Global Fund supported countries. So there should be, we need to see the change in transition planning with key population benchmarks, community protection plans embedded in these transition plans as a meaningful requirement for the Global Fund grants. And so how do we do it? We can do the community of practice. Again, we mentioned several times, there is a lot of experience of cross-community actions, not only between the communities of affected population, but also communities or movements of human rights, feminist movements. So we can and we should do this continuing ongoing exchange within the Global Fund sphere system. learning by experience from the ground, from the regions. And the emergency support in human rights crisis should be there, should be led by the Global Fund, not only as a direct financial support to human rights frontline defenders, but also as a kind of knowledge exchange, at what is the information share hub for all of us to rely on. And there was a lot of activities we mentioned. I don't think I will go through all of this, but for example, of course, dedicating funding streams to community or cross-community building, including core support and staffing, support to communities as first responders. Frontline community need to be frontline infrastructure needs to be protected and increased. As we mentioned, we discussed integration in the whole stream of discussion of integration within this global grant cycle aid. So we need to pay particular focus to this. So leveraging catalytic investment to influence global fund grant discussion is really important. For example, if populations are not named, how we make sure that the services still continue reach those populations. We mentioned several times there is a lot of experience, not only in communities by us, but also in the Global Fund Secretariat and the Global Partnership. We don't need to reinvent the wheel. We need to rely on all these tools we already have developed: gender assessment, community-led monitoring of services, but also community-led monitoring of human rights, stigma indexes, CCM hubs, the discussion with CCM hubs, community connect, and so on and so forth. So youth council, importantly. So there is a lot of experience. We just need to make a concerted effort to bring it in one place to protect human rights beyond 2030. I think briefly that's it. And please, other people from our group, jump in.
No, I think you got it all, Vitaly.
And thanks, everyone.
You're getting well done's in the chats from your team members as well. So clearly you did a very, very good job. I think everyone did a good job of really trying to summarize the kind of deep discussions that you had in those breakout rooms for 45 minutes. Thank you so much as well for documenting them so thoroughly, because quite often a lot of this nuance gets lost. I mean, how much can you say in a 5-minute feedback? So thank you so much, because that really then feeds back into the team and feeds into their planning and thinking around these areas. So thank you, thank you, thank you again for doing that. So well done, all the teams. You're all winners. Everyone did a great job. So we're all winning here. So we have 9 minutes left, and there's just one little thing I ask of all of you, just a little bit of input that I think will really help support and guide the team. So one of the things that came up in session 1 when Anna was doing her presentation. She was talking about how this is one of the first times that there's been community engagement in this way in this subject and on this topic. And so what we want to do just in the next, let's say, 3 minutes is we want to think about what are other ways to ensure meaningful community involvement, not only in this process, but through implementation. So we don't want this conversation to end. It's not a once-off conversation. So to do that, we've put together a quick Mentimeter. You'll see the link in the chat. If you could just click on that link, and what will come up is a question around what are creative and practical ways to ensure meaningful community involvement, not only in this process, but throughout implementation. And I want you to think of not only your standard issue kind of community engagement calls, surveys, things like that, but think of processes you've been a part of where you really thought, wow, this has really taken community engagement seriously. This has really listened to what people are saying in a deep and meaningful way. And what are some of the techniques they use? Because I know the team also wants to have new creative ways. We don't have to do things the same way they've been done over and over again throughout the different years. So if everyone could please click on that. And if you can't access that, feel free to put it in the chat. But what we're really wanting to do is collect some ideas from this group of what could community involvement look like? What are the different things that we could do to make sure kind of our fingers are on the pulse of the people we are trying to serve? So I'm just going to give us 1 or 2 minutes to please apply your mind to this question. I can share my screen that has, so it will come up. So you can also be inspired by what other people are saying. So if you put it in the Mentimeter, it will come up live. And we're just going to do this for a minute or two before I hand over to Anna, who I know is very excited. So we have direct funding, the scorecard approach, more digital, more AI. Go beyond consultation during the proposal development. Communities should be funded and engaged throughout implementation, monitoring, accountability, and decision making. Maybe if the French interpreter can help me with some of the interpretation on the French interventions. Okay, wonderful. And we have ongoing community of practices. We have co-creation at all stages. Stop viewing communities solely as beneficiaries and instead regard them as fully fledged stakeholders. Wonderful. So what I'm going to do, because I know all of you are still thinking, is that I'm going to keep that link open, as well as tomorrow we'll provide a summary of the session as well as the slides. I'll provide the survey results as well as these links, so that if you're still thinking about it tonight and suddenly in the middle of the night you're struck with a genius idea for community participation, you can still add that to the link. I'm going to keep the survey open for another week as well. So we'll keep the survey all week till Friday. So I know some of you didn't have a chance to kind of convene with your communities. So you still will have time to fill those in should you need. So don't worry, this doesn't end here. There will be opportunities to continue and continue contributing your experience. On that note, I'd love to hand over to Anna.
Thank you, Ishtar. And mostly, thank you, everyone. We do not take it lightly that you've taken the time out today and last week to spend a good nearly 90 minutes, 2 hours with us going through this. And as we said right at the start, this is the first time we're also trying this for a catalytic investment, to have this really early input into the design, and as we work on developing a detailed investment proposal that goes through our fairly rigorous processes internally. So thanks for your flexibility, first and foremost. Doing something virtually at this scale is really challenging. And we also really like to thank Ishtar, who was called in at quite short notice to come and help with an idea that had not much fleshing out. Just, can you help us convene our really important community stakeholders to gather some input? And I think we'll give Ishtar a round of applause. It's been really great. But also hearing all of you, and as I said in my group, we just do not have enough time to sit together and go into real depth on these topics, but we really appreciate what you've brought out today. We have heard so much rich data, even in this short term, that integration, must be on community terms. So across every discussion today, we have that consistent themes that come out, that communities are really those essential health system partners. They need to have protected funding, legal status and national frameworks, real decision-making power, not just consultation. So good integration is what preserves what makes community responses work. CLM is such a hot topic, and nearly every conversation it's come up, despite having its own thematic chat, it's in every conversation, and that's just a reflection of how important CLM is, to communities, but to the work that we do. And that strong consensus that we need to find other ways to really anchor it in that national health planning policy. And I think sort of language coming about it. CLM is real data. I mean, we all know this. And I really like the point in the other group where we need those advocacy professionals within networks. Maybe it's bringing these pieces together, because sometimes how we think it's communicated makes sense, but maybe to others it doesn't. But CLM, how do we really keep working on convincing people that it should be in a national framework? It is the health data that health systems need to be built on. It is the quality assurance data that we're looking for in supporting to deliver on the outcomes across HIV, TB, and malaria. And transition, of course, is really one of the most omnipresent thoughts at the moment. There are so many components or countries on a transition timeline now because of the situation in terms of global financing. And that we really need to find that way to help support through those accelerated transitions. And in my own group that I was listening into, where are these sticky points? There's so much work still to do around the legislative frameworks, and particularly where spaces are really becoming very restrictive. Not being NGOs, becoming a private enterprise, maybe some switch that needs to happen in some regions. Continuing to advocate with government makes sense, and it is a little bit somewhat easier when it's directly related to health services, but we still have that critical challenge of how do we preserve the advocacy and the accountability components of what we've all been working on. And that those resources must really follow the work that the system can't do for themselves. So the movement building, the legal advocacy, the communications, the stigma reduction, the peer support, none of this is funded by project outputs. And we really need to keep working towards that dedicated, flexible, ring-fenced funding for communities and community-led advocacy and institutional strengthening. It's just not a nice to have. It's really what keeps us and the systems honest that we're working in. Really rich thoughts around the cross-movement building, but already what we have a rich resource of, the CCM, the learning hubs, CCM hubs, youth council, our community connector. How do we bring these voices together? How do we bring this data together? I think today was a bit of I had a light bulb moment as we're going through the wrap up. I was like, oh, we have all of this rich stuff out. We don't have enough forums to bring it together to input into this work. So again, thank you so much. I hope I sort of captured it. We will be using what we got today. It is going directly into our design. And as I said in the first session, these are the catalytic investments that the Community Rights and Gender Department have. Across human rights and gender, as well as building community networks and engagement. And we're going to try and make sure that they really align to these priorities that have merged out. We will come back with an update of what it's looking like. We're still yet to decide also, because we're doing a learn by doing approach as well, how to come back to you. And it might be in just a similar plenary format, or we'll do one of our community connectors, but we'll certainly be sharing that progress. But we also want you to be involved across the implementation lifespan of these catalytic investments. So we're building into the design how we can have these regular touch points and sort of, course correction where we need it. Is it working or not? And just a reminder, these are very small buckets of money. So we've still got to keep our eye on the big prize, which is within the allocation and how they can be maximized. But this catalytic investments can be really used to spark the learning, the the peer-to-peer exchanges, finding these advocacy approaches where we haven't had before, how we can, evolve CLM into something that you're all asking for, and building those sustainability conversations. So there's a lot of us within our pods, but just on behalf of all of our team here at CRG, we just really appreciate the time that you've been able to spend with us today, and to really help us shape this idea. And we're going to keep making sure that this becomes a part of the best practice of the work that we do here at the Global Fund, and hope others will follow us internally. Thank you.
Thank you so much. And it's 4 minutes over, but I think we covered a lot in a very little time. So expect an email from us that has all these little bits and bobs. So thank you so much for taking the time. Hoping that you have a beautiful week further. I mean, not those in Cape Town. The weather here is absolutely miserable. Torrential rains, it's madness, but I'm hoping wherever you are, the weather is fantastic. Bye. Feel free to unmute and show us your face, even for a little second, so I can know who we've been to. Oh, there we go. Faces.
Thank you,
Oh, that makes me
everyone.
happy.
Bye.
Look at
Thank
that.
you. Thank you.
Bye.
Bye-bye.
Oh,
Ciao.
Bye.
wonderful. Hey.
Ciao.
Wow, that does make such a difference. I love
Yeah,
seeing
so
people's
nice to see
faces.
everybody.
Is that everyone?
I think so.
Okay. Go team.
Yeah, I think we should thank our.
How was
Thank you,
that?
everyone. Thank you to our interpreters. Can we just also give a quick shout out?
Yeah.
Oh, so amazing.
Thank you.
Thank you.
Thank you so much. Wow.
All right.
Thoughts, feelings?
Yeah, it was great. There's just not enough time. I wish we could have people for a week in a room and really nut this out. Yeah.
Yeah, can you imagine? I feel that was such a rich discussion, but if it was actually physically in the room, yeah, I think we would have gotten even more out of it. Amazing.
I mean, they always, if given more time, that this can be pieced out and designed to be a kind of where you do like maybe 3 or 4 sessions over a period of time with some connections, but it requires a lot of design to get at, because you can replicate in person more than one thinks one can, but it takes much longer.
But I also think there is a benefit in having something so short and concentrated. And I'm just very impressed that everybody was very, very engaged. Like even in and I think small groups really help with that, because then if there are only like 4 or 5 people in the room, like then you have to engage. You cannot just like sit on the, in the sidelines and listen.
And the fact that over the 2 sessions there were roughly 50 odd people in both also speaks to something, which is amazing, which is not what I expected. I remember in the beginning when we were talking, 20, 30 people, like 20 people, that's a good number. So to have 50 people across both sessions is amazing. People really showed up.
Can we give another shout out and like round of applause to you, Star? I think like it would not have happened if you like didn't really, first of all, organize all of us, like a bunch of cats.
I hope you see my style of emailing as things as like I get called I get called a friendly fascist because I do quite and I hope you see it as friendly and cheerleading and supporting and not being a fascist.
I don't think that word can be applied to number one, but number two is I think it's really, really appreciated. And I think I actually I've never engaged with Google Suite or whatever you call it, but the whole stacked approach I think worked really well.
Okay.
All right, so now we have a lot of stuff to process.
Okay, so what I will do immediately now is what I'll do is I'm going to clean up these slides. I'm going to do what I did before for the summary. So we'll have, let me just while it's all fresh in my mind. So a summary of session 2, the survey link for people who still need it, the Mentimeter link for people who still want it, the breakout slides. I'll do it like I did last time, which is I just uploaded it in my Google Drive as a PowerPoint and shared the link. So they don't get the live, so they can't edit it. Breakout groups. Is there anything else that they need?
I think so. For the summary, I think it explains what we've done, right? Like rather like what the kind of how to inform the decisions. And my understanding from some of the questions in the chat is that people would like to know how the consultation inputted in the next design. I think this is what Anna addressed in the last response, saying like whether there will be a community connector or not. So maybe we can also need to flag it when we communicate it.
Yeah.
With the expectation that it might not be exactly the same 50 people in the room. But if I were a community member, I joined the consultation, I spent 2 days, and then I never hear back because the next session was with a different set of people. I would, so I do think we need to think internally how we want to do it and whether we want to have some kind of product we want to email everybody afterwards, which is a little bit more than just the summary of the session. But I think that's that's the question.
Yeah, I think it's good for them to have a summary of the session
Of
just
course,
so so they know, and also specifically because they have the links so that they can do kind of the consultation with their communities and things. And then what I'll do is I'll try and start pulling together both session 1 and 2 into like the content into kind of one document and place to make your lives easier. Because what's your deadline again?
Let's not go there. Let's keep it on the happy note, feeling very accomplished. We will start stressing tomorrow. But yes.
But what I can do to help your deadline and your situation is I'll start pulling everything we've done into kind of one document so you have it and you can easily access stuff and it makes your life much easier.
Yeah, no, that will be very, very helpful. And that's definitely something that it's a huge priority given how tight